of the relapses, most of them, 42%, the plurality, were in the first 12 months after diagnosis, and 27% of the relapses were in the second year, and then 31% after the end of the second year. And actually, most of the patients, of the 109 who relapsed, 62% went to the doctors with symptoms. So they had new symptoms. So symptoms are very important. If you have cancer, you really have to listen to your body and go to your doctor, because those symptoms might be a sign of relapse. So these are people that were not diagnosed with CAT scan. They had fevers or lumps or bumps. They maybe had pain.
Yep.
They had an abnormal physical exam. Some had abnormal blood tests. There's a blood test called LDH. And 87% of the people had multiple symptoms. Either they had an abnormal blood test, physical exam, or the symptoms. And actually, the minority of patients, only 1.5%, had relapse detected by CAT scan.
Okay, wow.
So it's telling you that the majority of the patients, listen to the patient, listen to the doctor, listen to the physical exam, because maybe that is going to help you understand what's going on. I'm not telling people not to have follow-up CAT scans, because I think it's important to know where the disease is. But it's also important to listen to your body and to understand what's going on.
Doctor, what sort of symptoms do you commonly hear about from patients or patients who are diagnosed with cancer or have a relapse?
Most common symptoms are pain, lumps or bumps, fevers or chills. And then in this category that reported in this journal were also abnormal blood tests.
Okay. So there are ways to, if you will, check to see what we're feeling, what the problem may be with blood work and, through a physician in the practice, in the field.
We have our first caller of the day. This is Dave from Providence, Rhode Island. I want to say good morning, Dave.
Yeah, good morning. Hi, my name is Dave. Patient Dr. Lederman. How are you this morning?
How are you, Dave?
How you doing, Dave?
Great.
So what has you calling us this morning at so early, 6:45?
Well, I'm in the middle of back in Providence, Rhode Island. I'm painting a house.
That's not why you're calling us. You're not calling us for painting the house.
Well, I'm up doing just having my coffee and just getting a day going, you know.
Okay, so what has you calling us?
Well, I had melanoma 23 years ago when I was in the service. I got treated at Walter Reed Army Hospital.
Dave, do you want to explain to the listeners what is melanoma?
It's initially caused by the sun, usually a change of a mold. This is how I, information I got from doctors. This is like the doctors talking, not me, because I'm not a doctor.
So melanoma is a cancer that forms on the skin.
On the skin.
And what part of the body was your melanoma?
Below my right knee.
And did you detect it, or your doctors first detected it?
I kind of ignored it about 25 years ago.
How long did you ignore it?
Well, till the mole initially fell off, to my discredit.
So was it for months or years that you ignored it?
Years.
Years. Okay.
But when I got in the service, they hit me with a bunch of shots. I was training 18 hours a day.
Mm-hmm. Thank you for serving in the United States military, by the way, Dave.
Thanks for supporting, troops and whatnot. But I initially was in the second phase of training. I noticed a lump below my knee, like the size of a grape.
Wow.
And, it was just, I figured it was just a cyst. They gave me the runaround quite a bit initially when I was at Fort Dix, New Jersey, but when they finally, I saw a dermatologist, he took it off, they diagnosed it as a, melanoma. Once they got me to Walter Reed, they further did tests, did a needle biopsy, found out it metastasized into my groin, lymph nodes in my groin area.
How many years ago was that?
23 years ago.
Uh-huh. All right, Dave, the listeners should know, number one, this is a lesson for everybody. First of all, sun exposure causes melanoma, so doctors like to advise patients to try to avoid excessive sun exposure or wear creams. And if you have a mole or a lesion on your skin that's changing, you should seek medical attention immediately.
Absolutely.
And that the risk of melanoma is related to the size or the depth of penetration. The more it grows through the skin, the greater the chance of spreading. So your melanoma was diagnosed all these years ago, and it's spread. I know you, Dave, because Dave knows me. He's going to probably talk about that. And
I'm going to tell the truth, Doctor. That's people have to know out there what I'm here, what everything's about.
Well, what does that mean? What do you want to talk about today?
Well, I just want to talk about when I had my reoccurrence. Someone did do their job. I was at the Providence VA. Look, I'm not going to get into...
Yeah, I don't know. You don't need to tell us exactly where and when. So why don't you tell us, so you were diagnosed 23 years ago. You had a melanoma that grew quite big. It spread. And now you're here 23 years later. So why are you here 23 years later? You must be doing something right to be here 2.5 decades after diagnosis of a metastatic melanoma.
Well, when it reoccurred, I mean, of course, it's initial shock. It was like total panic. Sure. Initially. So I kind of like turned around and said, all right, I got to go get some outside opinions. First place I went was to Rhode Island Hospital. I got an opinion there. Then I, as everybody does in living in Rhode Island, I ran to Boston. I ran right to Boston, and I got their opinion. And I wasn't really overly impressed with what they had to say at Dana-Farber, I'm going to be honest with you.
Okay, so what happened? Do you want to? We don't want to talk about bad news because it's a difficult disease. So what happened to you? How did you get treatment, and how are you still doing? And how's the melanoma today?
Well, we're going to talk about that, but I, like I said, I'm here to tell the truth and to lay the facts out for other listeners. I got a hold of my original doctor. He worked out of Johns Hopkins, Walter Reed. Bethesda, and now he's at Barnes Jewish Hospital in St. Louis, Missouri, which is a fine institution. I got his opinion again, and when you got cancer, stage 4, like you got to sort it out. You know what I'm saying?
So how did you sort it out?
Well, I was about almost over a year and a half ago. I was at my old helter-skelter ways. I'm in a bar room about 8:30 in the morning. And a buddy of mine walked in, a truck driver, Teamster truck driver, makes runs to New York City. He said, I'm listening to this great talk show about radiosurgery that are having tremendous results and whatnot. He said, look, I'm a blue-collar man. I'm a truck driver. What do I know about cancer or being, doctors or what they do? But he says, he got me the number, and I went down to Lower Manhattan and went to a radiosurgery clinic.
Who'd you meet there?
I met a Dr. Lederman.
Oh, there we go.
That sounds like a pretty good doctor. So, so you're calling as a testimony. Tell us, you went there, and what was your situation?
My situation was pretty grave. It was pretty trying, but I'm going to tell you how independent, how some outside opinions influenced me. I was impressed with the doctor at Rhode Island Hospital who later wound up in Poughkeepsie, New York. Mm-hmm. And this is really, everything was independent. Nothing's biased here. I had a PET scan done in August 2012 last year, which showed extensive spread of disease, melanoma.
Sorry to hear that.
Bone involvement, a lot of disease in the lower abdomen. And about 2 years ago, not to bounce back, people at the VA hospital said you got about 3 to 6 months to live.
It's pretty sad.
Other doctors said you're definitely going to die from this and whatnot, and you go in a state of panic.
Sure, of course, Dave.
Try to stay focused. Number one is to stay focused and listen to outside opinions. So I had my PET scan done in August, and I started radiosurgery treatment in the month of September.
Do you want to explain